Hello! So today we're going to talk about a topic that isn't talked about enough, and we're going to look at some simple techniques for trying to self-help you to keep things moving, okay? And it helps if we understand what a body is supposed to be like. And this is with kind permission of the parents that we show you here a young boy who is squatting the way nature intended. That is the way we are supposed to sit around the campfire. That is the way we are supposed to go to the toilet. And it builds around the way in which our body is biomechanically intended to go to the toilet. And in parallel, think about how a dog gets itself into position to actually pass stools. So we need to bear all of that in mind on what really our bodies are designed to do. So let's move on from there, and we're going to very quickly have a look at a few things. So we're going to look at a butternut squash, which is a bit body-like, and we have our stomach and we have our little small intestines. So everything is digested here. Make sure you've chewed properly in your mouth into small particles, because your guts don't have teeth, and then it comes down through these small intestine, and finally on the right hand side here you will find it moves from your small intestine to your large intestine, at which point it becomes a wider pipe which comes up underneath your ribs, and sort of there's a bit of a corner in it, and then it comes across and up here and there's a bit of corner in it, and then finally on this left hand side of you, your guts solidify and the peristalsis pushes your stools out of your body downwards, okay? So it can be very helpful to massage in the direction in which your guts go. So that involves rubbing up on the right, across and under the ribs, and down and out. And so you're just going round and round and round, okay? But we're going to come to what you need to do to make that facility better. And then you've also got on your back, it's obviously you're coming up on the opposite side. So what I mean by that is you're going where on one side you're going what looks like clockwise from the front, but perhaps feels like anti-clockwise from where you are. On the back, you're coming up on this side still, so like you were coming up on this side and coming across and down, you're coming back up on the right hand side, across and down. So then it'll feel like you're kind of doing it the opposite way round. But basically, just that gently will help facilitate stools to move, but specifically if you are in the proper squat position. So your squat position is getting your knees as near to your chest as possible, like the little boy in the first picture. So if we look here in this very, very helpful book, which is cited at the bottom here, your gut, your body's most underrated organ. You will see up here these little pictures. If you've got this little figure here sitting on the toilet with their legs at right angle to their spine, then their gut will be curved like a C here. And so it's not naturally predisposed to expelling its contents, because they can sag around in there and they can form little pockets, diverticular issues arising, and you can get diverticulitis. Whereas on this little person here, they have got their knees up nearer to their chest and they're leaning forward to help also to get their knees and their chest closer together, and as a result it stretches the pipe, this last pipe that leaves. And so if you remember the squatting boy, get onto the toilet, and you don't need a special higher, lower toilet or anything, just bring in from the side one of these standard little step stools, slide it in from the side, which will put your feet on and it will bring your knees up. Keep yourself as upright as possible, leaning forward so that your body and your knees are together, like the little boy, and you will find it makes it a lot easier. Also remember that moving helps, drinking water helps. So if you've not got enough fluid going through your system, then stools can get a bit dried up. Moving regularly so that you're upright and opened upwards as opposed to squashed down, will encourage with gravity and things like that. And another little tip, lastly, is the Bristol Cancer Clinic, now the Penny Brun Centre, as early as sort of the 1980s, was recommending that people worked on this section of their hand. Now, in reflexology terms, that is the pelvic area, it is this area. And the way that you do that is you fix your hands like this, so this avoids you straining. You fix your hands like this and you work this area. So I'm demonstrating it here so that you know which area. And I'm then coming in from this side and I'm working in. So I'm going from here to here to here to here to here. And I'm coming from here to here to here to here. But I'm actually massaging that area and the same the other side. And you do both hands. So you'll probably find it easier to be sitting on the toilet doing this, being upright, but working your way in. So I've shown you that, like that. And then you'll probably find it easier to do the other way, like that. But you'll know what I'm doing. I'm working in rocking motions in both directions. And that should really seriously help so that you don't have to strain, because straining can cause pockets, diverticular issues, and all sorts of other problems. But you do need to keep things moving. It's called a waste product for a reason.